All right, hello and welcome to the WPS GHA webinar on medical review findings in outpatient rehabilitative therapy services. And today we are talking about the daily treatment notes. My name is Mary Sue Gardner, and I'm a nurse on the Provider Outreach and Education Department. And I'm joined today by Rachel and Jennifer, who are the other nurses on Provider Outreach and Education, and as well as some participants from medical review who will be assisting with the chat and the question and answer portion of today's call if they're needed. So this is the last in that four-part series that I hosted this week on various components of therapy documentation issues. Should you find that you were unable to attend any of the other parts of this series, they will be posted to our YouTube page as encores within the next week of the event. On your screen right now is our disclaimer, which we must show at each and every one of our educational events. And our disclaimer basically says that we prepared this education for you following Medicare law, rules, and regulations as they stand today. But those laws, rules, and regulations change frequently. And it's your responsibility as a provider to make sure you are practicing within the current laws, rules, and regulations. So if they change tomorrow, it's up to you as a provider to make sure you're following what changes tomorrow. CMS also prohibits our audience from recording this presentation for any profit-making purposes. So no recording, no screenshots, because we don't know what you're using them for. So we ask that you not do that, and we are recording it for you, and it will be on our YouTube channel for you to refer back to at a later date. On your slide right now, and if you're following along with this slide deck, is a list of acronyms. Now, this is a total list of acronyms that I would commonly refer to in any therapy documentation, any therapy documentation webinar. So I've just included everything that I could possibly say, and if I happen to use an acronym that you're unaware of, please just refer back to this acronyms list. My overall objective for today is to help you, the providers, learn about the medical review findings surrounding the daily documentation of therapy services. And we're specifically focusing on PT, OT, and SLP services. So I hope to achieve this today by reviewing the coverage criteria surrounding your daily treatment notes. We're going to discuss the essentials of documenting those daily notes. We're going to talk about some common findings that the medical review entities see, so you can avoid those findings, as well as give you some tips that may help you better document your daily treatment notes. Now, if you've been participating, or even if you participated in the large event that was held in January that was over all coverage criteria of therapy services, you've seen this information, but I want to reiterate this information anyways. So the coverage criteria for outpatient rehabilitative therapy services, regardless of the place of service that you render it at, is formulated in the outpatient regulations. So this slide just points you to those regulations, and it also refers you in these regulations to the additional places of service, such as inpatient, like an inpatient rehab facility or skilled nursing facility. It refers you there for the more specific regulations. So remember, if a place of service is silent in their regulations on a specific coverage criteria for therapy, then you should follow the regulations outlined in the outpatient therapy services. And here's where you can find those. And if you are following along, this chapter 15 is actually hyperlinked to bring you right to that section of the manual. Now, each and every day, I've also discussed the overall basic coverage criteria for outpatient therapy services. So we're going to just quickly review those again today. I'm not going to be spending a lot of time on it, but it's important to understand and remember that the overall coverage criteria for outpatient therapy services, what the criteria is, as this criteria also plays a huge role in documentation issues that lead to denial of services. So starting out, the services need to be a need-based services. When you think about need-based, think about why that patient needs you, your skills, your expertise as a licensed therapist, that nobody other than you could provide the services that this patient needs to hopefully get better or improve with their condition. You have to render your service under an established plan of care. So the other day we talked about the evaluation and plan of care. So the plan of care needs to be established by the physician or non-physician practitioner, but generally the plan of care is established by the actual therapist. But it is allowable either way. The care must relate directly and specifically to the plan of care. So you can't start treating other areas of the body that weren't already discussed in the plan of care or in some sort of update to the plan of care. So the care also needs to be provided to a patient that is under the care of a physician. So we don't require an order, but we do require a certification. So that's how we verify that your patient is under the care of a physician. So there are components of certification that must be met. So you can refer to the webinar that was hosted yesterday on certification and recertification if you need more information on that, or right back to that benefit policy manual, and it will give you that information as well. And then the last thing about certification, make sure your certification is legible, that it's dated and signed. Electronic equivalent is great, but if your physician happens to sign it, like sign your hard copy and then scan it back in and send it to you, please make sure that that is legible. Okay. So as we move along, let's talk about the basic required documentation pieces for therapy services. So these are the things we've gone over all of this week. There's the evaluation and plan of care, and that includes any necessary reevaluations, certification, and any necessary recertifications that need to be done, the progress notes or reports, whichever way you refer to them. And then the last component of required documentation is the daily treatment notes. And here in that section of the regulation in the Benefit Policy Manual, Chapter 15, is where you can find the specific information about the daily treatment notes. So since that's what we're here to talk about today, let's get into it. The purpose of these notes is simply to create a record of all treatments and skilled interventions that are provided and to record the time of the services. And really, this is done in order to justify the use of the billing codes that you are putting on the claim. So there are some specific coverage criteria that I want to talk about. The treatment note itself is not required to document the medical necessity or the appropriateness of the ongoing therapy service. It's simply a record of what happened for that day. So really, when we're looking for the appropriateness, the medical necessity, we see that component more in your progress reports. But there are some things that you can be adding to the daily treatment notes to really help with that supporting medical necessity. But let's move on and talk about the criteria that needs to be met in your daily documentation. All right, so coverage requirements. Documentation is required for every treatment day and every therapy service. The format is not dictated by us as your contractor. It can vary depending on your practice or the responsible clinician or the clinical setting itself. So we don't tell you how to document, but we do have some specifics that we need in your documentation. I caution you as a provider of these services, don't sell yourself short in your daily documentation. Although a therapy grid could be an acceptable piece of documentation of your daily services, it doesn't always allow you the availability to capture any additional information about your patient on that day of service. So for example, what if a patient presents that day and they're seeing the therapy assistant that day and they have maybe new complaints? Where would the therapy assistant document those complaints? What about any subjective information that is quantified then with objective and measurable information? Where would you put that? So like the patient says they have less pain today, and maybe you or your assistant, whoever's treating the patient that day, quantifies that by asking where they are on the pain scale today. So yesterday you said you were an 8 out of 10 with your pain, and today you say your pain is 6 out of 10. So we can see a significant difference by just giving us the objective information. But if you were only using graphs, where would you document that? So a preferred way of documentation would be something that not only allows you to state the modality, intervention, time, and person providing the treatment, but it also allows you to capture any subjective or objective information that you gather from your patient. So as we move on, let's talk about documentation of each treatment and the things that should include. So the regulations actually say your documentation of each treatment has to include the following elements. So the date of treatment, identification of each specific intervention or modality provided and billed. So like your CPT or HCPCS code. And you need to put those down for both the timed and untimed codes. And it needs to be written in such a manner or in such language that it can be compared with the billing on the claim to verify the coding. So if you are writing a code, that's fine. If you are saying therapeutic exercise and we can verify that code, you know, is for therapeutic exercise, then we can prove that. Record each service provided that's represented by a time code, regardless of whether or not it's billed, because the unbilled time services may impact your overall billing. And we're going to talk about this, you know, closer to the end of this presentation. So also be sure to document total time that in treatment minutes, the total time of treatment as well. So total treatment time includes the minutes for time code treatments and untimed code treatments. Total treatment time does not include time for services that aren't billable, like rest periods. For Medicare purposes, it's not required that unbilled services are not part of the total treatment minutes that you are recording, although they may be included voluntarily to provide an accurate description of the treatment and to show consistency with the plan or even to comply with state and local policies. Finally, we also need the signature and professional identification of the qualified professional who furnish the services each and every day. The signature and identification of the supervisor does not need to be on each treatment note unless that supervisor actively participated in the treatment. So since a clinician must be identified on the plan of care and in the progress notes, the name and professional identification of the supervisor responsible for that treatment is assumed to be the actual clinician, the PT, OT, or SLP who wrote the plan or report. Well, SLPs we don't recognize assistants, but for OT and PT services. So when the treatment is supervised without active participation by the supervisor, again, is not required to co-sign that treatment note as long as it's written by the qualified professional, such as the PTA, OTA, or CODA. When the responsible supervisor is absent, the presence of a similarly qualified supervisor on the clinic roster for that day is sufficient enough documentation to support that services are being provided, under the supervision of the licensed clinician, such as a PT or OT. So again, at a minimum, your documentation needs to have the date, the identification of each intervention or modality, such as a CPT code, the actual minutes associated with each modality, and the signature and the professional identification of who rendered those services on that day. Now, there are optional elements. Documentation of each treatment may also include some of the following optional elements that can be provided by the PT or the assistant. If these aren't recorded daily, any relevant information that you want to include should be rolled up into your progress note. So optional elements, even though they're optional, I highly encourage you to utilize some sort of documentation that could incorporate this stuff. If your patient presents and they have any kind of self-report, they want to tell you something about how they are feeling, how they are doing, how they did after therapy, that's something really you should capture, especially as an assistant providing those cares. It's important that the therapist knows what the patient is self-reporting. If they had any adverse reactions to any of the interventions provided, such as if an intervention caused them to have more pain or caused them to have more weakness, we would definitely want to have you as the therapist know about that. If there's communications, consultations with other providers, and especially if there is significant, unusual, or unexpected changes in clinical status. Now, this one's a big one because sometimes if there is some sort of significant, unexpected change in their clinical or functional status, this may warrant a formal reevaluation by the provider because your plan of care may no longer be relevant. So you definitely want to make sure there is a means for an assistant to capture something like this. And then other things, if there was any equipment provided or any additional relevant information. So let's continue talking about gathering additional relevant information or documentation and how to make this more effective to showcase your expertise. First, make sure all of your documentation is customized to your patient. Every patient is different, so all documentation should be different. Every day with your patient is different as well. So any additional elements that you gather on your patient at each daily service should be different. When documentation looks like it's canned or it appears to be the same day after day, we may start to question the services provided and if your services are, actually being provided on an individualized basis. So as a therapist, even as the assistant working under the therapist, showcase your expertise. Why does it take you and your licensure? This is so important in the progress notes aspect of your documentation as well. Your progress notes we talked about the other day are really where you're putting a lot of your eggs when you think about the baskets you're putting your eggs in. No, that's the place that makes the big difference. That's where you're really showcasing. But your daily documentation is helping your licensed therapist use the information to showcase their expertise in the progress notes. Keep your notes simple and clear. As a Medicare contractor, we don't expect you to write a book for each treatment day or each treatment element. What we need is clear, concise documentation of the service provided. Who provided it, what the service was, maybe how the patient responded, how long did it take. Don't be too vague. Vague information about what was performed or how the patient responded or their progress towards goals does not do anything for your overall case. So remember the words objective and measurable in all aspects of your documentation. So whenever you can provide those lengths or weights or distance, percentage, any measurements at all, then do so. It will behoove you in your to document your daily notes and especially your progress notes in this manner. And finally, make sure you're including any level of assistance and cueing. And this helps both the therapist as well as any potential medical reviewer see how much assistance that patient is needing on a daily basis and if that assistance is lessening. All right. So how can you improve your overall documentation? Connecting activities to the goals. Try to articulate how each activity aligns to the patient's overall goals. Now, some of this information, again, is going to be obvious in your progress notes and in your initial plan of care. But when you're formulating your evaluation and your initial plan of care and developing your goals, you start to also say what kind of activities you're going to do on a daily basis to help achieve these goals. So whenever we can make that connection, it's only going to benefit you. Also, when you're providing education, make sure you're linking your education to your functional goals. Show how the education provided contributes to functional improvements. If you are monitoring vital signs, make sure your daily documentation includes the vital signs that you're monitoring and any relevant changes. Recording subjective comments. So make sure you capture the patient's subjective feedback and observations, and when possible, quantify that with objective and measurable information. Keep your services patient-centered. So ensure that your treatment remains centered on that patient's unique needs and aspirations. And then record your patient progress. Now, us, as well as most insurance companies, want to see that your services are working towards your patient's goals. If there are no changes or the patient is plateauing and you're really working in a rehabilitative program to try to get the patient better, you may need to change your approach to the care, or you might need to discharge the patient. So when you are thinking about the progress and thinking about the services that you are providing on a day-to-day basis, if there's the opportunity to jot down how they've changed since the last treatment day, do it. It's only going to benefit you. All right, and we're going to end our day with some of the common findings that medical review entities, be that us, your Part A, Part B MAC, or the CERT contractor or the recovery auditor, commonly come across when reviewing therapy claims, specifically on the daily notes. So the first thing is missing signature, missing daily notes. I went one slide too far, sorry. We started today saying the purpose of these notes is simply to create a record of all the treatments and the skilled interventions that are provided, and to record the time of the services in order to justify the use of billing codes on the claim. So documentation is required for every treatment day and every therapy service that you provide. Without this daily documentation, we can't support the services were provided as billed. Remember, the daily documentation must contain the intervention or modality, the actual treatment minutes, signature, and professional designation of who provided it. So no note equals no payment for that day. So keep that in mind. The next common issue with daily documentation is missing signature and professional designation. So again, in order to support that the services are provided by the proper individuals, the documentation must contain the signature of that person that provided that service and their professional designation. We can accept initials in a treatment grid as long as you provide the signature log that goes along with it. So the signature log, if you do that, must contain the printed name with credentials, as well as what the initials are and how they would appear in documentation, as well as the signature of that person and the date that that was formulated. If you keep a separate signature log, make sure you make that available upon request for medical review. Some of the best documentation of daily services that we see actually have like a grid at the top part of the page that the CPT code, time, and initials are placed in, with space for additional information to be captured below the grid. That's kind of how it looks like when it's printed and submitted to us. Then it's followed by like a brief signature log for the dates that are on that specific page. And that is, it's all in one that way, and that is a very much acceptable way to document as well. Remember, electronic signatures and professional designations are allowed as well. So if your electronic signature appends to your documentation, make sure your professional designations append as well. All right, as we move on, missing minutes of service. Now, we've talked about this a lot, and I've said it several times. Document the actual minutes of service provided. Even if you are providing a modality that is an untimed code, document the amount of time you spent in that modality of service. Again, this helps to support the overall time the patient spent in therapy services that involved one-to-one skilled interventions. It also helps to support the complexity of the service that you are providing and the time it takes you to provide that service. So remember, whenever you are documenting any treatment modality, make sure you include time and time spent overall in therapy services. And then the final component is reporting more units of service than minutes documented. So I have a link on this page. So if you have the slide deck, you can link on this. And it's going to take you to the Claims Processing Manual, Publication 100-04, Chapter 5. And then in Section 20.2, you're going to see this grid that appears on the screen, this picture, how it breaks down units of service. So a few things with this. When only one service is provided in a day, providers should not bill for the service that is performed less than 8 minutes. So you can see one unit, it has to be somewhere between 8 and 22 minutes. For any single timed CPT code in the same day measured in 15-minute units, providers bill a single 15-minute unit for treatment greater than 8 and up to and including 22 minutes. If the duration of a single modality or procedure in that day is greater or equal to 23 minutes through 37, then you would bill 2 units. So here's that breakdown as well. When more than one service represented by 15-minute time code is performed in a single day, then the total number of minutes of service determines the number of timed units billed. So I'm going to give you an example. 24 minutes of neuromuscular reeducation, which is 97112, was provided. And then they also provided 23 minutes of therapeutic exercise, 97110. So 24 minutes of 97112, 23 minutes of 97110, which makes for a total treatment time of 47 minutes. So we fall into this category here. So using this chart, that falls into the 3-unit range. Appropriate billing for this 47 minutes using 3 units. Each of the codes that is performed for more than 15 minutes, so each shall be billed for 1 unit. So the correct coding for this would be 2 units of the 97112, because remember I said that one was 24, and 1 unit of the 97110, because that had the lesser amount of time spent. So hopefully that makes sense. Another example, 7 minutes of neuromuscular read, 7 minutes of therapeutic exercise, 7 minutes of manual. So that's a total of 21 total minutes. So even though there was 3 different CPT codes provided, it still only falls into 21 minutes. So in this case, since each of these were performed for the same amount of time, you would pick one. You would pick 97112, 97110, or 97140 and report 1 unit, whichever one you want to choose. Which one do I think you should choose? Choose the one that pays higher. All right, so hopefully that was clear for everyone. And if it was not, you can always send a question into the chat. All right, so some tips. We've gone over a lot of info today about documenting your daily treatment notes. So let's review some useful tips that you should remember from today's event. Make sure you are documenting each intervention, modality of service that is performed for each day of service, and capture the time associated with the intervention or modality, even if it's not a timed code. Again, because that helps support the overall time in your services and the complexity of care provided. Ensure that there is signature and professional designation with each daily note. We have to be able to verify who provided the service. Finally, make sure that the units of service billed are not in excess of the actual minutes of therapy provided. So if you have someone that is designated as a biller for your office or your company, then make sure that they understand how to accurately bill units of service to Medicare and send them back here and make sure they are reviewing this chart. We would hate for you to get into a situation where you were documenting it and performing it right, but the biller is billing in excess of charges, because then it could be construed as abuse or even fraud. All right, so in summary, my objective today was that you learned how to avoid medical review findings in your documentation of your daily notes. We accomplished this today by reviewing that coverage criteria. We went over various documentation essentials, common findings, and even reviewed some great tips to help you avoid these. So at this time, I'm going to see if there are any questions that have come into the chat. And I just looked over at the chat, and usually I'd have Jennifer or Rachel tell me, but I do not see any questions in the chat at this time. So I'm going to go ahead and proceed on, but if you have a question, I will pause again at the end and go through those questions. So if you have a question, please place it into the chat. All right. We ask you please to take a survey on this event and let us know how we did and what other education you would like on therapy services in the future. Your opinion really does matter to us, and we want to assure you that we take all survey comments very seriously. And actually, this whole week of therapy documentation was created based on survey comments that ask for additional training on each of these different components of documentation. So we do thank you for that. And again, we take your survey comments very seriously. You have the opportunity to take the survey while we are still in session by going ahead and scanning this QR code that's on the screen with a smart device such as a tablet or your smartphone, or you can use the link that Jennifer just placed into the survey. And if you don't want to utilize either of those, when you close out of the webinar, you're actually going to be directed to an external site, and the page is going to look just like this. It's going to have a yellow triangle, and then the destination site will say something about CMS and Qualtrics in there. And that's just WebEx's way of telling you, hey, you're going to a site other than WebEx right now, and you're taking the CMS Qualtrics survey. As I mentioned, in a little while after this event closes, you're going to get an email thanking you for attending. Don't delete that email without first reading it. First of all, it has another opportunity for you to take the survey if none of these other options worked for you. Secondly, it acts as proof of attendance for you, and it contains your certificate of continuing education hours. So here's your certificate of achievement if you were to need to submit that for continuing education hours. If you only called in via phone and did not log into the webinar portion, you will not receive this email. You will need to email us at wps.gha.education@wpsic.com and provide your name and phone number that you called in from, and we will get a certificate sent out to you. Should you have any follow-up questions after this event is over, you can still send those to us via email at the email address that I noted, and it's right here on the screen as well. We ask that you send those questions within the next 10 days of this event and include the name of the event in the topic part. So you don't have to say this whole thing. You can say outpatient therapy daily notes, just simplify it, and they'll get that sent off to me to answer. We will any questions that have come in, if they are pertinent, if I think they're pertinent enough to everyone, and I'll develop a document and send out an email that contains those questions and answers out to everyone. If you have questions that are claim related, unfortunately, we can't take those via this email box. You will need to call customer service with those, and please don't send any PHI or PII through email. We would hate for you to get in trouble for sending that and us to get in trouble for receiving that. Also, remember that this was the last of the 4-part series on documentation. So the first was evaluation, plan of care, and reevaluation. Next, we covered progress notes. Then we followed it with certification and recertification. And finally, today's on the daily treatment notes. So please visit our YouTube page to view the list of encores, and you can link to that right from our live events page on WPS GHA. All right, I do not see any questions. So on behalf of Provider Outreach and Education, as well as our Medical Review Department, we want to thank you for taking part in this educational event and educational series for those of you who have been here all 4 days. We look forward to your participation in future events as well. So at this time, you may now disconnect, and happy leap year.